You had a large tumor. You elected to have both of your breasts removed. I probably would not have done an immediate reconstruction.
The left one's very hard.
The problem really was having the reconstruction immediately at the time, knowing that she was going to have radiation.
And very stiff, and it's always cold to the touch. Right one feels like it's falling off my side a little bit.
Dr. Kuzley and I both feel very strongly and very passionately about providing this kind of light at the end of the tunnel for breast cancer survivors.
One on the right side, for some reason, has just fallen apart. It wasn't quite done right to begin with, but it's falling down. I think it's turned sideways. It always looks very awful. And I see people looking, and they won't say anything because people are polite.
It's insult unto injury that
it is. I hate being vain because I'm alive, but it really does help. When you get up in the morning and you look at yourself, and I'm like 10 years older and my boob's falling off, and I know I'm going to have to go out and spend the day in front of the public.
Linda had a fairly extensive breast cancer that initially, as you know, was treated with mastectomy. She had immediate reconstruction with an implant, and then after that she required radiation therapy to complete the treatment along with chemotherapy. And what the radiation has done is caused a significant amount of scar tissue around the implant, making that implant feel really hard, uncomfortable, and also has been pushed up higher as compared to the opposite side.
The problem really was having the reconstruction immediately at the time, knowing that she was going to have radiation.
I probably would not have done an immediate reconstruction in your situation, realizing that you were going to have radiation post-operatively, post-mastectomy radiation therapy.
Linda never should have had immediate reconstruction given the fact that radiation was very necessary in her treatment. But she felt rushed to make a decision and thought her doctors knew best and were communicating with each other.
You don't have to make your decisions immediately, that you have some time, that you can get other opinions, that you can see as many people as you're comfortable with. Now, some people see too many people and get confused, but I think that that's clearly a message, is that it don't have to be rushed. Your decision, you should make your decision based upon a gut level comfort that you have, given the information that you've gathered.
I was told at one point, you can't have radiation now, and then the oncologist tells me, oh, you have radiation or die, and now the plastic surgeon says, oh no, the radiation's going to ruin your implant.
Dr. Kuzley and Dr. Hartley are involved in an interdisciplinary breast cancer conference held every week in Boulder. This group meets to make sure the mistakes that happened to Linda won't happen to their patients.
Many different specialties, including oncology, general surgeons, plastic surgeons, physical therapists, nurses, and basically we go over all the newly diagnosed breast cancer cases that come through Community Hospital, A Vista Hospital, and also see other patients that may be referred in from elsewhere as well. We go over their case, their pathology, their X-ray studies, their MRIs, and then put our heads together to figure out what is the best treatment option for that particular individual.
What we have here in Boulder that's such a plus is, getting everybody together literally in one room so they can bat these ideas around. Everybody knows what everybody else is thinking and planning, so you're on the same page.
In this particular circumstance, it would have been known that with her particular tumor characteristics that post-mastectomy radiation therapy would be performed, and that immediate reconstruction was then not necessarily a good option. So our plan is to reverse some of the changes from the radiation, bring in healthy tissue so that that area can then settle and heal, soften, and be more symmetrical with the other side.
And even if you don't live in Boulder, you can still access this amazing interdisciplinary team with referral from your oncologist.
Breast cancer is always with you, but you want to be able to have some closure at some point. to where it's not continuously on your mind.
It's a shadow walking behind me. I'm so grateful and thankful to all of you.
Well, I think we'd both agree it's probably the most rewarding part of our practice is doing our breast cancer reconstruction patients, because you really, you give people light at the end of the tunnel when they come in with a cancer diagnosis and they're looking at chemotherapy and radiation and mastectomy, and every place they go they're getting bad news. We can say, hey, yeah, there's all that bad news, but we can help.
My mom is a breast cancer survivor. She had bilateral mastectomies when I was in college. Her plastic surgeon just had an incredible impact on our life, which is what drove me to do this in the first place.
We get as much satisfaction from this and helping patients as what the patient generally reaps from it. This is it's a very stimulating part of our practice. It's always challenging, it's always different. And the rewards that we see in terms of the results that patients have and how much better they feel about themselves and how much better their life is, it's a no-brainer.
Dr. Kuzley and I both feel very strongly and very passionately about providing this kind of light at the end of the tunnel for breast cancer survivors, and any opportunity that we have to give back to that aspect of the community, it's the most rewarding aspect of, I think, of our jobs.